Thank you so much for staying with First Issues. We continue our series on the most common lifestyle disorders in Botswana with Dr. Kiran Bhagat, who previously spoke about cardiovascular diseases as a general term for conditions affecting the heart or blood vessels. He returns tonight to share his expertise on yet another lifestyle disorder, asthma. Doctor, thank you again for coming back on First Issues. We're continuing a series on the most common lifestyle disorders in Botswana. Previously, we were talking obesity. Right now, though, we're moving on to asthma. Let us talk about that one.
Asthma is a condition of irritability of the airways. It is a condition where the airways of the lungs begin to close down as a result of a stimulus. Whether that stimulus is something that you breathe in, or whether it's something that you fed yourself, or injected yourself with if you're taking some sort of injection or whatever. So you can have an allergy to penicillin. You can have an allergy to certain foods. For example, peanuts in children can cause asthma. Or you can have an allergy to pollen. Or to fumes. For example, when BCL was working, we'd had a lot of asthma attacks in Piquet. So that's something that we've had for centuries. What is different in terms of lifestyle disease is we've noticed in most countries worldwide, and Botswana is no exception, that there's an increasing diagnosis of allergies and asthma. And one has to ask why. And there are various hypotheses, and I'm not an allergy expert, but one of them is what we call the hygiene hypothesis, where children are now prevented from going out. They're told to wash their hands, which is quite correct. They are not playing in the mud or playing in the fields, or they're not playing out in Massimo or Moraka. They are in an urbanized situation. You know, we protect them overly. And so they're not exposed to germs and to dust and to pollen and to mopani trees. And so when they are exposed suddenly, the body's not seen it, so they're not adjusted to it. We know, for example, that families that have cats and dogs are much less likely to have children that are asthmatic. We know that children that grow up in farms are less likely to be asthmatic. So we know that there's a certain element of being with nature that the body builds up an immune system. And immunity to it by what we call homeostasis, which basically means a small amount of a toxin introduced to the body gradually gets the body immune to it. So a small amount of cow dung or a small amount of pollen or a small amount of whatever it is, eventually the body becomes immune to it. And we believe that this may be partly why we are seeing more asthmatic children. We are seeing more children having allergies to peanuts or to milk or to dairy. When you ask, how come I don't, as a parent, I never had these things, skin rashes, eczema, they're all part of the same allergic profile. And so in terms of treatments of asthma, there are the inhalers, there are the pills, there are nebulizers that we do use. But often one has to ask, why is it that it's going up? And the purpose of our series is to talk about lifestyle. And we do know that the thing that has changed is our lifestyle. So we have to ask, what is it? It is the tobacco that surrounds us. It is that we live in an industrialized world where there are more fumes, there are more exhaust fumes. We are dealing with more insecticides and pesticides and fungicides. We are also consuming water from plastic bottles, and we know that those microplastics are getting into our system. We know that some of the foods that we eat are grown in soil that is fertilized or insecticized or herbicide that goes into the root, and now we're consuming it. We know from studies on placental blood from newborn babies that the blood of the placenta is showing increasing quantities of chemicals in there that are going into the fetus. So we know that those chemicals which the mother is consuming or breathing in may be affecting the baby. We know that, for example, cheap cosmetics, cheap lipsticks, contain what are called phthalates. Phthalates are things that are lead-based that you put on your mouth, and we know that most women, I don't use lipstick, but most women lick their lips. So you can imagine how many times you're licking that lipstick that you are swallowing, that is getting into your system, that is getting into your blood, and if you're pregnant, will pass into your baby. So these are all things that we believe may be going on in terms of the increasing allergenicity of the population at large. So treating the allergy by giving an antihistamine or giving a steroid or giving an inhaler is quite correct. And adherence to this medication and inhaler is important. But our series is to address why is it, and these are the questions that we're beginning to ask in terms of lifestyle and how healthy is it to live in a cubicle? How healthy is it to live with artificial light rather than go out into the sun? How unhealthy is it to live in a room rather than go out and play in the fields?
Let me understand here, and maybe I am wrong in my confusion. Can we use allergies or having an allergic reaction to something that causes you to not be able to breathe be the same as having an asthmatic attack?
Having difficulty to breathe can be caused by a number of issues, and it's not necessarily asthma. Asthma is something that the individual, the patient themselves, or the parent themselves will know that if I expose my child to a certain perfume, or if I expose my child to the jacaranda flowers during jacaranda season, I know that they're going to get asthma. So we know the trigger and we know the consequence, that the child or the adult begins to wheeze, and that wheezing sound is classic of asthma. And some people, they don't wheeze, they just simply cough. But being short of breath doesn't mean you have asthma. Wheezing generally defines asthma because you can hear that there's a tightening of the airways. But being short of breath can be from a number of things. It could be due to the fact that you have punctured your lung. It could be that you have pneumonia. It could be that you have tuberculosis. It could be that you have heart failure, and as a result of the heart not pumping well, blood is getting stuck in your lungs. It could be that you have kidney failure, and because the kidneys are not washing out the waste from the body, it accumulates and deposits in the lungs, so you get short of breath. So because a listener out there may be short of breath, don't assume it's asthma. Assume that you are short of breath and that the diagnosis has to be made by the hospital or the clinic or the doctor by listening to your chest, by examining you and asking if there are trigger factors. Is this something that's related to the blood pressure that you have, or the diabetes that you have, or the kidney issue that you have, or the pill that you're taking? So it's not as easy as that.
See you again next time when we continue this series with a look at diabetes.